What are the three most common causes of an upset stomach, constipation, and diarrhea? Let's talk about that today. Hi, I'm Dr. Murray with Murray Natural Integrated Health here in Hastings, Nebraska. And people have a lot of digestion problems. Almost everybody has at one point dealt with poor digestion and some kind of symptom. We have that as one of the most common complaints when patients come into our office. Fatigue, stomach problems, joint pain, those are all very common symptoms. And actually, they can be very, very much integrated and connected to one another. So let's talk about the three most common causes of an upset stomach. Some of these things are kind of basic. You would think that you might already know these things, and you probably already do. Other things might be just a little bit harder to detect, a little bit harder to understand. So number one, for an upset stomach, eating too much. If you eat too much food, a lot of times we go to a buffet or we have a lot of food present, we'll eat as much as we can. And the older we get, the tougher it is for our bodies to digest, to absorb, to tear apart foods because you have proteins and carbs and fats and you throw them all together, especially with a big evening meal, it's difficult to digest. So number two, the wrong foods, which kind of gets into too much food as well. But honestly, there are a lot of people who are just drinking alcohol, too much alcohol. We know that alcohol can tear down some of the intestinal barrier, some of the mucosal lining of the stomach and the intestine, and can make it irritated. So it can cause irritation. Also, you can have people that just eat foods they just shouldn't because they have intolerances or they have sensitivities. So there are lots of people that do have dairy-related intolerances or lactose intolerance. Other people that have sensitivities and allergies. In the Mayo Clinic, they also acknowledge this as a fact that there are a lot of people that do have intolerances to different foods. Some people are sensitivity to gluten, and also medications kind of mess with your stomach as well. So I'm throwing that into kind of the food category because sometimes the things we take in are actually upsetting our stomach and causing some of the symptoms. For instance, ibuprofen is one of those medications that can upset your stomach, and so can aspirin. So if you're having some of those symptoms, you probably want to address your medications and talk to your provider about that. Obviously, another reason for an upset stomach could be bugs, viruses, bacteria, H. pylori, enteritis, and gastroenteritis caused by different types of viruses and bacteria. Very common reason. So if you have an upset stomach and it doesn't go away, you should have that fully investigated because you could be having some type of a bacterial infection that needs to be properly addressed. And those that have chronic, long, ongoing symptoms, and maybe it is related to a bug, maybe it is H. pylori. A lot of times you might take an antibiotic for that particular condition, and it's like, well, it goes away for a while and it comes back. Well, did you actually kill the bug, kill the bacteria? Maybe not. So you need to make sure that you're looking into it. Some kind of tips for helping to reduce an upset stomach? Well, don't overeat. That's pretty obvious. You don't want to put too much into your stomach all at one time. Eat slowly. Don't eat quickly, because when you eat very quickly, your stomach fills up and you don't really feel you're that full, but until it is too late. Don't eat past into the evening, past 6 o'clock time frame. When you eat too much close to the bedtime, it gets very difficult for your stomach to digest. You're digesting all throughout the night. Sometimes that's difficult on a person as well. And don't eat a bunch of junk food. The junk food, the processed foods, those are the most difficult ones to consume. Lots of dairy, these processed foods, they're difficult for your body to digest. And almost everyone, talk about dairy and lactose, almost everybody's body does have a decreased potential to digest lactose as they age. We are designed to consume dairy as little tiny critters, and as we grow into adults, many, many, many of us lose that enzymatic ability to digest lactose, to make the enzyme lactase. So that's another food that is often upsetting people's stomachs. How about constipation? Some of the three most common causes of constipation. Well, some people just lack dietary fibers. They lack the soluble and insoluble fibers. So your soluble, insoluble fibers come from your fruits and vegetables and nuts and grains and these types of foods. Now, a lot of people will get in wheat bread. They may get in breads of a variety of sources and also maybe get in rice. But depending on how those things are processed, they may not actually have a lot of fiber to them. For instance, if you have white bread and it's been very processed, it's not going to have a whole lot of good fiber in it. So your insoluble fibers, which are kind of your bulk enhancing ones, which are a lot of your vegetables and grains, they help to grab and kind of clean out the digestive tract. And so if you're not eating vegetables on a regular basis, you might not be getting enough fiber. Also, your soluble fibers, such as your fruits and pectins and those things, they have a whole nother effect. They help from the digestive process as well and help with constipation also. So it's important to get those in your diet. But if you do end up taking extra amounts of insoluble fiber, make sure you are drinking plenty of water, because you can become constipated that all by that, just taking too much fiber and not getting enough fluid. There are some people that also, number two, a second reason for having constipation is they just lack exercise. You know that movement creates movement inside your digestive tract. So if you go out walking, your intestines start to move. So I have a story back when probably around 15 years ago, we had an old farm dog that would go out, my wife and I, as we went out walking or perhaps jogging around out in the country where we lived. And every time that we go out walking or jogging, Pepper, the old dog, would come out and start jogging out in front of us. And when Pepper started jogging out in front of us, she started to poop. And that's the reality is that when you move, it also, when you exercise, it actually moves your digestive tract. So if you're not exercising on a regular basis, you're very likely to have an increased amount of constipation. Your body's designed to move, and your intestines need that movement as well. In fact, a lot of times when you go to your provider and he is actually checking on your tummy to see if it's working properly, he's going to auscultate, he's going to listen to it. He's going to listen to it with a stethoscope, right? But he is not going to touch your tummy before he listens to it, because when he touches it and palpates, does an abdominal exam and touches it, as soon as you touch it, the intestines start to move. It'll start to create all kinds of bowel sounds if you touch the abdomen. That's why you're supposed to look, listen, auscultate, and then palpate later. So you're supposed to, the last thing you do is touch them, and to actually touch and to actually examine with your hands, because if you do it beforehand, you're going to cause a bunch of bowel sounds. So movement to your bowels, it's important. So getting the exercise is important. Medications, we know that many medications cause or contribute to constipation. Your opioid medications, your pain medications like that, we know cause constipation. Some antidepressants will also cause constipation, and also some antihistamine and medications will also cause constipation. So you need to be looking at your list of medications and talking to your providers about that, because sometimes it's the medications we're taking are making things worse as well. So just some few little tips. You don't want to make sure you're plenty hydrated. Drink enough water for you. Drinking half your weight in ounces is not a toxic amount of water, but that's a good amount of water. It'll make sure you're plenty hydrated. So half your weight in ounces is a good amount of water. Talk to your provider about that. Exercise, great thing to do in general. Everybody should be doing some exercise for the sake of your digestion. So make sure you're doing those things. Diarrhea, 3 most common causes of loose stools, diarrhea. Number 1 are food intolerances. And even the Mayo Clinic, you go on their website, they acknowledge this. I'm not making it up. The Mayo Clinic, they talk about this. So lactose intolerance, fructose intolerances, sensitivities, allergies, including artificial sweeteners, these types of artificial sweeteners and additives, as well as intolerances and allergies that people have to certain foods, all those are major reasons for day-to-day related diarrhea. Now, there are other people that have true infections. Okay, so if you have not had any diarrhea and all of a sudden you start having it, you have to start asking, why is this happening? Chronic related reasons, you might think of those food intolerances, those types of issues. But when you're starting to talk about an acute related issue with diarrhea, it might certainly be something dangerous. So something like a salmonella infection, or of course, C. diff, or some other kind of serious infection like that. So if you do have diarrhea for longer than a day, you probably should have that checked out. Another reason for diarrhea would be chronic related digestive problems. And that could include like IBS or perhaps gallbladder dysfunction, irritable bowel syndrome, which again probably is related to a lot of food related intolerances. But still, IBS is one of those reasons that can cause diarrhea, usually also caused by a little bit of stress. Usually it's some kind of a stress event. You're getting up to maybe do a test or to talk to somebody. Maybe you're doing a presentation. some stressful environment, and all of a sudden you have to go to the restroom all of a sudden. Gallbladder dysfunction, if your body is not dealing with bile appropriately so that you can actually use that to digest your fats, that could be a big issue. So those chronic related digestion problems can be really something to deal with. And again, foods, perhaps even like I said with the gallbladder dysfunction, that might be related to how your body's producing bile. And so that might need to be investigated there. So what are some things you can do about diarrhea? Well, you can try some soluble fiber. Soluble fibers, such as your pectins, they tend to help with diarrhea and loose stools. A good probiotic, right? That's always been recommended. Long time probiotics have been recommended. So that's one thing, of course, you can certainly try out. Cutting out your dairy, because those people that do truly have an intolerance to certain types of foods, such as lactose, you might not be making lactase as much as you used to. So certain types of foods, it's going to be important to eliminate. The probiotic, we mentioned that. So that's regarding diarrhea. So we mentioned 3 most common causes of upset stomach, of constipation, and diarrhea. All these things can contribute or cause what they call gut dysbiosis, where there's an abnormal amount of microflora or pH or enzymes that are present in your GI tract, and it's causing your body not to be able to absorb nutrients effectively. Remember this, that if you have a bad tummy and you're not absorbing things quite like you should, and you're having diarrhea or constipation or upset stomach quite often, you are not absorbing nutrients. You might be low in vitamin D or B12 or a great number of things. Or how about if you have constipation and you're not actually vacating the things that should be leaving your digestion tract every single day? Well, you might be absorbing things you don't want to absorb. So gut dysbiosis, an abnormal amount of good bacteria, bad bacteria, other types of microorganisms, it's an important thing to understand. The first thing you try to address are foods. And that's why I talked about those intolerances, and kind of addressing those things first is always a good thing. If you have questions on that, you should contact us or the provider of your choice to look into those things more directly. But in a good stool related test, you can actually look and you can see what kind of microflora are present, the good bacteria, the bad bacteria. You have certain bacteria all over throughout your digestion, your digestive tract, into your lower bowel or upper bowel, and your stomach, also your esophagus. You also have microflora in your mouth and also in your lungs that are normal to be there. And when an abnormal amount is there, it causes some kind of dysfunction. It messes with your immune system. For instance, you should have some more lactobacillus and kind of more your upper GI tract, and bifidobacterium in your lower GI tract. If those things are off, you can have dysbiosis, an abnormal amount of microflora that are there, and that can cause just an abnormal amount of absorption of nutrients and cause other microflora to proliferate, creating an environment for other types of bacteria and yeast to actually proliferate. So through a stool test, you can actually test for those microorganisms. Inflammation. In a stool test, you can actually measure how much inflammation is in the small bowel or the large bowel, and the causes of that inflammation. That's where you kind of need to look at, of course, your foods, but perhaps you're not actually creating enough digestive enzyme, which gets into the next kind of point. You can actually test the amount of digestive enzyme that's potential through a stool test. And then, of course, you can test for significant infections in a stool test. So yes, we have found things like salmonella and also H. pylori on stool tests. And sometimes people need to have some crisis intervention, that's for sure. A lot of times people will start to have abnormal tummy problems because they have taken an antibiotic for some other reason. And we know that antibiotics 100% can mess with your own normal microflora. So a good stool test is a good follow-up test for those who have had, well, some acute related type digestion problems, but also with chronic ones for sure. Usually in our office, if somebody has some chronic digestion issues, we end up going through these basic things, these most common things that you should be doing anyways. But secondly, you start looking at food-related sensitivities, because that's the things you can affect the most, right? You can't really control what you breathe, but you can't control what you eat. And what you eat most certainly will have an effect on a lot of symptoms in your GI tract. But third, if you've investigated those things pretty significantly, and I don't mean that you've just had like a skin scratch test or something like that somewhere, because that is not significant enough test. Or maybe you've been tested for celiac disease. I'm sorry, there are other things you could be sensitive to that's not gluten or gliadin, two components of wheat. There could be other things that you could be having reactions to. Foods are important. Foods are important before any kind of supplement. But you also want to look at the lower GI tract, because through a stool test, you can see what's coming out. You can see all those things I just mentioned. Microflora, the inflammation, you can see the digestive enzymes that aren't there, including any kind of other infections or abnormal microflora, parasites, or any of those that might be present. So bottom line is that these things do affect the rest of your body. There are lots of people who have tummy problems and they have joint pain. They've got tummy problems and they've got foggy thinking, cognitive issues. They've got tummy problems and they have actually inflammatory arthritis, autoimmune conditions, even Hashimoto's thyroiditis, and a number of different conditions. Your entire body's immune system at least is somehow connected to the GI tract, either directly or indirectly. That's the two areas that your body probably has the most immune system reactions going on at one time, or two areas. Your lungs, where you intake air, there's a lot of immune system reactions occurring in that area, and in your tummy, because you eat things all the time that have microbes in it. So that's a super important area to kind of have down pat and see what's going on in those areas if you're having problems. So those three most common causes of an upset stomach: constipation, diarrhea. Give our office a call and we'll help you out in any way we can to get to the root causes of those problems. There's always something you can do to get to root causes of those problems. So give our office a call. That's Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed day.